Now, the 24th International AIDS Conference argued for youth and community activism in the creation of South Africa's new AIDS plan. It also noted the greater role youth and community-based organization can play in the implementation of such a policy. Congress was held between the 29th of July and August 2nd in Montreal in Canada. It was held against the backdrop of a faltering global HIV response challenged by the aftermath of the COVID-19 pandemic, the Russia-Ukraine conflict, and the general economic downturn. Joining us now to share their thoughts are Juliet Houghton, who was recently appointed CEO of the Southern African HIV Clinicians Society, and the country director at Clinton Health Access Initiative, Yogan Pillay. Good evening to you, and thank you very much for your time and for joining us tonight here on In Focus. Let's start with this rather contentious issue, which of course has come into the spotlight. 20 years of global health conferences. Researchers are finding that despite the fact that the diseases being discussed at these global conferences find commonality in global south countries, most of these conferences are being held up north. How do we influence the world to take us seriously in terms of what we think and how these diseases should be fought? If, for example, we can't afford the flights, we don't get the visas on time, but also there's just generally a low acceptance rate for research presentations. Juliet, let's begin with you.
Thanks, Thabo. Good evening to you and to your viewers. I think you've raised a critical point about access for attendees and research from the Global South. But I think what we saw at the conference was a huge push for that, and I think that's very encouraging, particularly from the community activism perspective, which has always been critical in the HIV response from day one, and still should drive and is driving the way that this is addressed. So I'm confident that we will see more access. We saw lots of research presented from our own researchers in South Africa and other parts of Southern Africa, and we need to continue to strengthen that because we've seen the World AIDS Conference held in Durban twice now, and we need to push for better representation and certainly access for the community who are at the heart of all of our efforts to be able to attend and present at these conferences. Yeah.
Dr. Pillay, I mean, global health conferences happening in high and middle income countries. What's your reflection?
Thanks very much, Thabo, and good evening to your viewers. Well, Juliet is absolutely right. It's absolutely wrong that countries in the north wish to host these conferences, but then deny access to the people who are most affected by it. Now, we have to take some responsibility in the South as well, and, host these conferences in the South and make it, feasible for people to attend by lowering the prices of the conference-free fees, etc. So, it's a dual-edged sword, but we need to do more in the South to attract these conferences as well.
Yeah. The theme for this particular conference was focused really around pathways to an HIV cure. We are still not any closer to an HIV cure. We'll talk a little bit about the research and some of the things that are being done. But do we have a better strategy towards finding one? Dr. Pillay?
Well, I think, you're absolutely right, Thabo. The search for a vaccine is still a long way off. The virus, as I think we've said many times before, is quite a clever and devious virus. So it's been proving very difficult to find a vaccine and, of course, and a cure. But, that said, what we do know is that we can prevent new infections. To have 1.5 million new infections in 2021, is very significant, as you say, decades after the discovery of the virus. Every 2 minutes, a young woman or young girl gets infected in the world. And in South Africa, we had about 210,000 new infections in 2021. That's equivalent to about 570 odd new infections every day in South Africa. So, we must be able to prevent the disease, prevent it from spreading. And of course, when people are infected, we need to be able to test them, put them on treatment, because we know that treatment prevents onward transmission as well. So while we search for a cure, Thabo, we've got to prevent new infections. I mean, that must be something, we must all put our minds to and really put our backs into.
Yeah, no, certainly, and we'll talk a little bit more on that. But Juliet, let's get your views as well. I mean, the sense is that if we want to completely have zero infection of HIV by 2030, one of the things that we will also need to do is to come up with a cure. But currently, researchers are pursuing a number of different and even contradictory hypotheses.
Sure. And to be fair, that's way beyond my academic remit. And I would have to leave that to Dr. Pillay and other experts. And I think that I would just reiterate, I know you want to talk about prevention separately, but Dr. Pillay is absolutely right. And it was one of the resounding take-home messages for me from IAS this year, was that actually redoubling our efforts around prevention is critical if we're going to end AIDS. It's not just about a cure. It's also about preventing new infections that are happening every day in South Africa particularly. And we have such a good array of prevention methods available to us now. The challenge remains how we get those to the very people who are most in need of them, whether they be adolescent girls and young women or rural communities or men who have sex with men or drug users, sex workers, it doesn't matter. We've got the technology, we've got the knowledge. We've just got to work out how to get it out to where it's needed. And that's why community involvement at these conferences and in research is so critical to ending AIDS by 2030.
Yeah. So while we are there, I mean, if you look at our national strategic plan, it is a little bit outdated. In fact, it was supposed to have been renewed about, was it 2020? But was it 2022? In fact, we should be having a new one. But that has been delayed because of COVID. So we are only going to get a new one in 2024, depending if we actually take the answer that we got from the Deputy President to an answer that he was asked in Parliament. But one of the targets that is set there, Juliet, is 100,000 new infections per year by 2022. Of course, Dr. Pillay has just said we hit 210,000, which means we did not hit target. And part of the challenge is that well, at least the critique that has been given is that the toolbox that we have does not match the impact that we are looking to have. What do you say to that?
I think, yes, of course, that's absolutely right. It speaks to us having the knowledge and the evidence and the research that says that these new prevention methods are effective, but we've got to get that out to people who want to use it. And some of that's related to cost of new products, but it's also about community awareness and creating the demand in populations to say we want to have access to this. And looking at how we can expand access to particularly prevention services to the communities closer to home. So relying on clinics or hospital services or private doctors doesn't always reach a lot of people. And we know this from the amount of emergency contraception, for example, that is used through pharmacies every month in the country. And obviously, if a woman is needing an emergency contraception, then there is a risk of HIV infection potentially. And we're missing a huge opportunity to strengthen the services that we provide to people closer to where they want them, whether that's close to work or close to home. So we need a collaborative response whereby we look at all of the things in our toolbox, which is now quite a full toolbox. We're not saying use one thing instead of the other. We're saying look at all the options available and choose what works for you. But that's only going to work if we can get the information to the communities and they can make those choices in an informed way.
Yeah. According to the UN report, which Dr. Pillay already alluded to, 1.5 million infections, I think, is what we were looking at in 2021. And that particular report pointing to the global AIDS response being in severe danger. And in fact, if it's not attended to quite soon, we could be seeing more numbers actually getting infected. However, it does point to South Africa having made, and Nigeria, I think, significant stride. It's not where we need to be, but we have not nearly done as enough as we should. One of the areas where we did certainly seem to be doing well is community-led and people-centered services. What are we doing right? Dr. Pillay?
So, I think we had quite a few lessons from the HIV epidemic and our responses to the HIV epidemic in responding to COVID. And now we've got to learn from COVID new lessons that we can apply to the HIV epidemic. So one of the things we did right was, I think, setting up the South African National AIDS Council with multiple stakeholders. Almost every sector of society is represented there. And of course, that's been cascaded to provinces, to districts, and even to wards. And you will see, Thabo, that in provinces where politicians take the lead at all levels of our community, we have a better response than if we just have a top-down approach. So a bottom-up approach with local community leaders involved, civic leaders, religious leaders, educationalists, it must be a whole of society response. It can't just only be a health sector response. And I think that's one of the lessons we've learned over the last at least 15 years. But now we've got to deepen that response. And that's what I think both the AIDS conference suggests, as well as what we've been saying in South Africa, that we need a greater push at community level. As Juliet said, we've got to take these new technologies, the old technologies, into communities, and people must own the response. And I think that's what's going to get us to some of these targets that you've mentioned. The 100,000, no more than 100,000 new infections, decreasing mortality from HIV, etc., etc. But one of the things we do have in our toolbox is an injectable prevention medicine.
I was coming there. I know you want to talk about that.
I'll let you get there.
No, we can immediately go there. So there is a cheaper, well, there isn't a cheaper, but there is a high prevention injection taken every 2 months or so. That works better, but it's expensive. And I believe, according to the numbers, it's about 300,000 rands for a year's supply for one person, when it actually could be around 300 rands. Now, we believe the company that is producing this has now kind of given some kind of voluntary license. Is this a good thing? Is it going in the right direction?
So, Thabo, first to say that this is potentially a game changer, because as Juliet said, the closer you can get things to communities, the less they rely on taking a tablet every day, the more likely people are to kind of prevent themselves from getting HIV if they are participating in risky sexual behavior. So this new injectable, you're right, every 2 months you can take an injection. It's called cabotegravir. It works. It's been shown in all the research to work really brilliantly. The challenge is the cost, as you say. Now, the company that's produced it, and there's only one company in the world, is called ViiV. And they've recently licensed their medicine patent pool to work with generic companies to produce it. But the challenge is it's not going to happen tomorrow. So there's a lead time to this, and it might be anything from 3 to 5 years. There's still a lot of discussion around it. So what we are encouraging ViiV to do is to provide it to countries with significant HIV burdens at a cost that the country can afford.
Yeah.
Now, the oral pill currently is about 60 rand per person per month. So we've been saying to ViiV, if you can give it to countries like South Africa for 120, 150 rands per person every 2 months, that's probably affordable. But if you're asking for anything significantly more than that, even countries like South Africa are not going to be able to afford it. So we've got a game changer. We've just got to now get society and our politicians behind us to get ViiV to reduce the price so that it becomes affordable, next year or the year after.
Yeah. How do we know, I mean, with the lack of transparency in terms of how pharmaceutical work in their pricing, that indeed we are getting good value for the money that we are paying. Maybe it might look affordable, but it could be even more affordable.
So we've done benchmarking, as the Clinton Health Access Initiative on a number of drugs. And, we have people who worked in pharmaceutical companies before. So we have some ideas and some good ideas about what these things cost.
Yeah.
Governments, including the South African government, does now benchmarking against global pricing on many products. So we therefore think, 150 rands for every 2 months for this injectable is about in the right ballpark. Asking for double that or triple that, is really, we think, not in the interest of health, but the interest of profits.
Juliet, one of the other areas that we seem to be heading in the right direction, not yet there, is the removal of punitive and discriminatory laws, which is one of those areas that could certainly help us in reaching those targets that we are putting in place. What still needs to be done, and is there a political will to move in that direction?
Thanks, Thabo. Yeah, I think there is. I think that, South Africa has some very good laws already in place, certainly in comparison to other southern and sub-Saharan African countries. But that doesn't mean that discrimination isn't still here, and particularly looking at things like the decriminalization of drug use, which is something that WHO is driving, and we're expecting statements from them shortly on that. But those sorts of elements that will enable people to access services more freely. Sex workers also are another group that's obviously heavily criminalized in terms of behavior and can often restrict access to prevention and treatment services. So I think, South Africa's ahead of the curve in many ways, but we can still do more around looking at how we can support people who feel very marginalized within our societies here. So I think that that's one area that we're doing well, but we could do better.
Yeah. Are we ready, Juliet, for the conversation? And are we having that conversation? Do we put saving lives ahead of criminalization?
I think, like so many things, a lot of this touches on personal beliefs and values and cultures and religions, and these can be difficult conversations. But certainly from my perspective, I'm delighted the conversations that we're having as the society with the Department of Health and others at looking at how we can move these things forward so that we do keep people's health at the top of the agenda. And that's everybody in South Africa, not just those who can afford it. So I think we're heading in the right direction with the work that we're doing collaboratively.
What's particularly alarming, Juliet, of course, in terms of the climbing number of infections that we have seen in South Africa, you've already mentioned it, it's young girls, young African teens and young women in particular. In terms of how we are responding to that, do we have, in your mind, a better strategy, or can we find a better strategy in how we communicate to that particular demographic and save our girls?
Yes, I think Dr. Pillay touched on it as well, which is about that, people's health isn't actually just a health issue. It doesn't belong to the Department of Health. It transcends all other areas of government and life for everybody. So I think one of the strengths of the approach now in South Africa is working very collaboratively with, for example, the Department of Basic Education, the police service, and so on, to look at, because obviously young girls, we hope, are going to spend most of their time in school. So we need to strengthen the school efforts around HIV prevention as well, and supporting young girls to stay in school, complete their education to matric, and avoid unwanted pregnancies. And we can't do that just from a clinic. We need to be able to reach families and young girls in their schools, in their churches, in their homes, and in the communities that they live in. So it's a societal response to a health issue that we need, and South Africa is certainly working in that direction, which is very encouraging.
Yeah. And what can the young people themselves do? Because you're saying what you encourage is actually more community activism that is led by young people themselves.
Yeah, I think ultimately young people leading it for young people is always the way that you're going to make a difference. If we can empower them with the knowledge and the skills and then provide the resources that they need so that they can then create the demand and they can come back and be shouting at us and saying, but we want this long-acting, cabotegravir injection. We want access to condoms in schools, whatever it might be. But young people themselves are perfectly positioned and have the ear of their peers. And so working with young people is always going to be the way. The same for any group that we want to target. It has to be with them. It can't be without them, which has always been the mantra around HIV from the early days. My historical early days in the late 80s, early 90s with ACT UP was exactly the same positioning of you can't exclude people with HIV from the HIV service planning. And it's just the same for young people. We need them. They're such a powerful and a large resource in South Africa that we need to harness and support. And I think the future then would be very bright if we do that.
Dr. Pillay, I suppose the push for tech does not necessarily mean we abandon the other strategies which we have been pursuing up until this point, and that is condom distribution, that is proper usage of condoms, and certainly medical male circumcision.
No, absolutely, Thabo. So, we have testing, and we'll encourage people, especially those that are, think they are at risk for contracting HIV, to test and test frequently, because it's only by testing you know your status, and you can go on to treatment immediately if you test positive, and if you test negative, then you're doing the right things, continue doing the right things. Consistent condom use, and we have male and female condoms, provided free by government. Government has now youth zones in all of the clinics that encourage youth, to attend these clinics after school. So there's a number of initiatives by government that I think we need to also encourage people to participate in. Otherwise we are going to have a legacy of HIV for us for another 20 years. And, as a country, we can't afford this. The pain and suffering and the misery that HIV has caused over the last couple of decades is significant. But the one thing I must say, Thabo, with increasing gender-based violence, with increasing interpersonal violence, with increasing inequities in our society, we are going to get all of these social ills which give rise to health conditions like HIV as well. So we've got to deal with, as a society, the inequities that we see, which unfortunately are growing. We've got to give young people hope. With significant unemployment rates amongst young people have very little hope. But by creating the conditions for employment, going to university, and getting a job, this is the kind of thing we need to get the youth to focus on not only improving their own lives, but improving society, improving the country as a whole. So, we've got to work together to decrease inequities in our society, decrease gender-based violence, and decrease interpersonal violence. We unfortunately, given our history, still a very violent society.
Dr. Yogan Pillay, I appreciate your time. And Juliet, Houghton, thank you very much for coming on and helping us in this conversation tonight. That was Juliet Houghton. She is the CEO of the Southern African HIV Clinicians Society, and Dr. Yogan Pillay, Country Director, Clinton Health Access Initiative, of course, outlining some of what still needs to be done in the country in our fight against HIV.